Acute psychiatry services will expand to all healthcare clusters to meet increasing demand and provide greater access for patients. Mental health disorders are among the top leading causes of disease burden in Singapore, and this is according to the Health Ministry. Chloe Teo has more.
The proportion of Singaporeans willing to seek help from mental health care professionals increased to nearly 63% in 2023, compared to around 56% the year before. That's according to the latest National Population Health Survey. To cope with more people reaching out for help, the Health Ministry is increasing avenues of support. Senior Minister of State for Health, Dr. Koh Poo Kun, announced the move at the Singapore Mental Health Conference.
Mental health services in acute hospitals remain an important and significant touchpoint for individuals with acute mental health needs, requiring specialist care and for those in crisis.
Currently, inpatient psychiatric care is available at more than half of the public hospitals, including the Institute of Mental Health and Tan Tock Seng Hospital. Outpatient specialist mental health services are also available at IMH and all other acute hospitals. One primary care provider says the latest move will go some way to destigmatize those receiving help.
A lot of my patients would want to avoid going to IMH, and if they do need a psychiatric hospital, they will also try to consider a private psychiatric hospital. And in that situation, our current services are also quite limited in the private sector.
A new practice guide for mental health practitioners was also launched. It aims to standardise assessments and referrals based on a patient's symptoms and care needed. The guide will focus on managing depression, anxiety, and suicidal tendencies.
I think this guidebook is useful because it promotes standardized tools that are used across the sector from community service providers as well as primary healthcare providers. And through the common tools that are used to assess the clients, we can put them into the different tiers.
A pocket guide will also be rolled out for the public to easily identify the types of mental health support available.
As the government moves to provide wider access to mental health services, what about the use of technology and AI to supplement patient care? Now, here to share more is Dr. Christopher Cheok, Senior Consultant and Chief of the Department of Forensic Psychiatry at the Institute of Mental Health. Dr. Cheok, welcome to the program. First of all, how do you see mental health services in Singapore being transformed through technology beyond just, more hospitals offering mental health care?
Good evening. Thank you for having me on your show. The main problem we face now in Singapore is that there are many people out there with distress, and the mental health services will not have the capacity to meet the demand currently. Also, a good proportion of people with mental health distress do not want to seek help at a professional mental health service. So we can augment the real-life face-to-face interventions with technology, allowing people to access care in an anonymous way through using apps or through using web applications. This will go far in allowing people to access care at a time that's convenient for them and in a way that they are comfortable with.
When it comes to using AI responsibly, how can we potentially harness it to help diagnose conditions like depression and anxiety? And what sort of limitations should we be aware of?
So currently, there is no AI that's good enough to be able to diagnose mental health conditions, especially the more serious ones. The risk of using AI is that currently, there's not enough regulation and not enough guardrails to prevent the AI hallucinating or speaking out of context. And sometimes the testing may not be robust enough to ensure that the AI doesn't go off course when certain scenarios are presented to the AI. What we use AI for is to assist us in our work processes, and such that the AI assists the clinician in decision making or in finding services. But the AI currently at this point is not patient facing. We do not know what 5 years down the line will look like, but certainly I think the vast majority of people, they still prefer to be able to speak to a professional if they can, face to face. Except that right now the number of professionals in Singapore is unlikely to be able to be increased very quickly. So we need technology to help us to meet the current demand.
So a lot of things may change in 5 years' time, but to what extent can AI chatbots replace professional healthcare providers completely, or are they just a step in pointing patients towards getting the right care?
I think currently the AI chatbots is able to do screening questionnaires based on a fixed screening questionnaire. We can definitely apply some WHO standard questionnaires to a chatbot. Chatbots can actually collect information for us, such as a patient's medical history or their psychiatric history, and these are kind of very static background information. However, when it comes to diagnosis, AI is still not quite there yet. The level of engagement between an AI and a human is still not to that quality that the vast majority of people would feel very comfortable with. So I think AI does have a role to play, but maybe not to the extent of diagnosis at this point.
As AI becomes more integrated into mental health services, Dr. Cheok, what are the ethical considerations and safeguards we must ensure to protect patients' well-being and privacy?
I think the biggest concern we have with AI is that if a patient presents with a suicide risk, a very suicidal patient there and then, the AI may not be able to prevent the person seeking harming themselves, or they may find it difficult to activate emergency services to get help to this very suicidal patients. So this is the biggest risk of using AI. Certainly, once a person converses with a chatbot, the chatbot sometimes can go off course and start to advise them on things that may not be so appropriate to the person's context. And of course, psychiatry, we need to be culturally sensitive. And today, many of the AI models are based on a Western culture, based on Western training. So they may not be able to be so culturally sensitive. They may be perfect on the language, grammatically correct in any of the languages, but sometimes they may not be able to interpret the cultural aspects so sensitively as a human would be. So I think the AI in the future may be different, but the state of technology today, I don't think it's as sensitive as what we would like to see it to be.
So how can informed consent be ensured when patients interact with AI tools, Dr. Cheok?
I think firstly, the person, when interacting with a device, they must know who they are talking with. Sometimes when you pick up a phone, today certain models are so good that you may not really know that the person, that the so-called person you're talking with is an AI. So when it comes to informed consent, at the start of the interaction, I think we must inform the patient that they are speaking with an AI, and specifically what is this AI designed to do. I think they should also know how to reach out to emergency service, or having a quick shortcut to a real human being should the conversations go wrong with a chatbot.
All right, I appreciate your insights. Dr. Cheok, thank you so much for speaking with us tonight. Dr. Christopher Cheok there from the Institute of Mental Health.